Hi, I'm Peter Benjamin, and I'd like to apply for this course. I initially was a software developer in the UK, moving to South Africa in 1994. I founded a university policy centre on ICT, and more recently have had 17 years of experience in digital health. I'm the founder and director of Health Enabled, a non-profit that does research, implementation and policy in digital health. One relevant project is this one. On behalf of Gavi, UNICEF, the World Health Organization and the Vaccination Demand Hub, we did research around the digital social listening for immunization, and I had the honour of presenting that at the 4th WHO Infodemic Management Conference. In this project, I interviewed many people, including members of the Vaccine Demand Hub in red on this slide. I'm also a health activist. This is us doing some community training around COVID 2 years ago. And my degrees are first in physics, then masters in information technology. My PhD is around info and comms technology for development. And I did a master's in public health at the London School, focusing on health promotion. Why do I want to do this course? Well, first, I know it will be excellent. I was on the infodemiology course last June, and it was very, very good. I mainly want to do this to do what I do better. I've been part of the South African Demand Acceleration Task Team reporting to the Minister, where I lead the South African Infodemiology and Social Listening Working Group. We get information from many organisations, over 40, and produce weekly reports of actionable information on COVID and vaccination sentiment, concerns and misinformation throughout South Africa. We work closely with the Africa Infodemic Response Alliance. I've also led the programme of Vax Champs. We have over 56,000 vaccination champions throughout the country. And what I would like from the course is first updating many of the areas I have some experience in. And also there's some I very, very much want to learn more on, to take back to South Africa and other countries that I may work in. Now, question 10. The governor is right that incentives can work. We tried it in South Africa and found it was successful in over 50s. If they're well targeted, they can work well. And there is a literature on this. But you need to be very careful to target them. Where there is widespread poverty, a certain small benefit is more effective than a larger lottery. And it's the other way round in richer areas. Think, is the luxury car relevant in remote rural areas with bad roads? And also think of a problem of success. If everyone does take it up, do you have the budget? And it's really problematic to do it in just one province. Inequity between provinces leads to rivalry, unrest, perhaps incentive migration between the provinces. And it could reduce vaccination nationally. So you definitely need to consult with other governors and the national government. Next, question 5. You need to flood the infosphere with evidence-based information and make it easier to find accurate information than the misinformation. Do not exaggerate and spread the misinformation yourself. Work with the fact sandwich. The fact, then a warning, then an element of the fallacy ending with the fact. Work through channels that are relevant to pregnant women, through trusted sources and influencers that pregnant women listen to.